Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Normal size but non-functioning uterus is usually with non-functioning uterus is usually with uterine synechia. That means the uterus is normal size but it is not functioning due to the synechia which are present inside the uterus. Then if you see exposure of the female fetus to androgens in the early embryogenesis leads to it may arrest the differentiation of urogenital sinus. Androgens, if you expose the baby to the in the early stages, then there will be no differentiation of androgenital sinus. Destruction of ovaries prior to 7th week following fertilization will result in destruction of ovaries prior to 7th week following fertilization will result in pseudohermaphroditism. No, if there is ovaries are destroyed, first of all, if ovaries are destroyed, what happens in the 7th week? There will be decreased estrogen. Because there will be decreased estrogen, there will be no secondary sexual characters. So, and because of decreased ovaries or destruction of ovaries, the female will complain of amenorrhea. Okay, so. And here the Mullerian duct development will be normal. Because Mullerian duct development will be normal, the uterus will be present. Okay, so that means pseudohermaphroditism means gonads will be ovary and external genitalia will be male. But here external genitalia of male is mainly due to the exposure of androgens in the female at early stages of development. But here there is no exposure of androgens. Here there is decreased estrogen. So this is not true. Then uterine agenesis, actually uterus is present. So this is also not true. There is no testosterone itself. So there is no chance of masculinization. So none of the above.
thank you and thank you for watching.